The Latino population here in Baltimore City has increased over 75% from the last census. But the obstacles for the Latino population to get care, I think, come from a broad spectrum of barriers. Like undocumented immigrants cannot access healthcare insurance in the U.S. Centro Sol stands for Salud in Spanish. That means health and opportunities for Latinos. Our mission is to promote equity in health and opportunities for the growing Latino population in Baltimore City and beyond, delivering research, community-centered programming, and advocacy. For example, we testified for the Healthy Babies Act that protects the health of women who deliver babies up to a year, regardless of immigration status. And that's a huge win, because if you have a healthy mom, you're going to have a healthy baby. And our strength, I think, is the partnerships. Our clinical innovations area, our community health, is done through identifying needs in the community for preventive care. Like, how can we educate people? How can we provide workshops? How can we provide support groups? We did a study not long ago about stigma around mental health. We asked about 400 Latinos in Baltimore what they thought about depression. Based on the answers to that survey, we developed a culturally relevant stigma campaign entirely in Spanish that reached 90,000 people online, including people from 14 other countries. And part of all of this also connects for building a pipeline for care. So our education component includes training graduate students of School of Public Health or the School of Medicine here at Hopkins. In addition, we have youth program for high school students to get them exposed to different careers in healthcare. That's my favorite because I am an immigrant and I'm a daughter of immigrants. And I've had this fire in my chest to find my place in the world. I was looking for that place, and finally BAHI came. I was an inaugural fellow of the Bloomberg American Health Initiative, and that has changed the perspective of how I do things now, like data-driven, evidence-based. The scholarship has definitely shaped my career development for now and ever, probably. I came from a very small town in Ecuador to be here, and that's pretty amazing. Now I have built my home here and I am contributing to my community, and I want to think that I'm being part of that change, that I'm being part of that improvement. So it's very close to my heart to do the work that we do at Centro Sol.